Hello everyone, my name is Raul Medellin, and today I will be discussing hypertension and its effects on the cardiovascular system.
So, what is hypertension? In order to answer that, I first must discuss blood pressure. Blood pressure is a force exerted upon the arterial walls of blood vessels when the heart contracts. This is normally measured by comparing systolic over diastolic values per millimeter of mercury. Hypertension just means that the blood pressure is higher than usual and places increased strain against the vascular walls. A normal blood pressure reads less than 120 systolic over 80 diastolic. A prehypertensive ranges with a systolic of 120 to 139 and a diastolic of 80 to 89. A hypertensive reading is anything greater over 140 systolic and 90 diastolic. The heart is greatly affected by hypertension. Blood flow throughout the heart may be impeded due to the high pressure being placed upon the blood vessels and heart chambers. Blood flow is worsened when plaque causes obstructions throughout the heart's blood vessels. This causes the heart to pump harder and faster in order to compensate for the weakened blood flow. This may lead to cardiac muscle exertion, meaning that performing physical activities may become a challenge due to the heart wanting to rest. The more the heart exerts itself, the more cardiac muscle starts to develop. Having more muscle seems like an accomplishment on paper. However, it is a crutch when it comes to the heart. The heart becomes enlarged and thick to the point where blood volume within the chambers decreases and further complicates blood flow. The enlarged heart then becomes inefficient when circulating blood to the body. Hypertension also affects the entire body's vascular system. The increased blood pressure placed upon blood vessel walls is constant. This means that the tissues of vascular walls are always under stress, causing them to lose their elasticity. Imagine a rubber band being stretched over a long period of time. After a while, the rubber band cannot return to its normal form due to the constant stress. This is basically a similar situation when high blood pressure affects the blood vessel walls. The constant stress can eventually cause a blood vessel to be damaged and rupture. This can lead to easily induced hemorrhaging and ecchymosis throughout the body, which makes bleeding control difficult to manage. There are many factors that can cause hypertension. All these factors can be categorized into genetic and lifestyle predispositions. Unfortunately, nothing can be done to prevent genetic factors leading to high blood pressure, other than managing it through medications and holistic approaches. Hypertension can be hereditary and passed down to offspring through multiple generations. The angiotensinogen gene has been researched to have been associated to inherited hypertension. This gene affects the offspring's renin-angiotensin system, the system that regulates blood pressure from the jugular glomerular cells in the kidneys. Elevated blood pressure may also be dependent on a person's race and ethnicity. Black and Hispanic people have been correlated to be more predisposed to hypertension than their white counterparts. Biological sex is another consideration for risk of high blood pressure. Lifestyle choices are a major factor that can cause almost anyone to succumb to hypertension. A person's diet can cause complications leading to increased blood pressure. One example is having a sodium-heavy diet, which can lead to atherosclerosis, which is plaque buildup causing obstructions in the arteries. A sedentary lifestyle can also increase blood pressure due to slow blood flow assisting plaque buildup. The use of stimulants such as caffeine, nicotine, and narcotics increase heart rate, which in turn increases blood pressure. Almost any kind of constant smoke inhalation may cause alveoli damage in the lungs, which forces the heart to pump faster and harder in order to compensate for the lack of oxygen. Age is also a risk factor. However, the lifestyle maintained by that person plays a major role in how healthy that person is. As I stated before, there are many disparities between race, ethnicity, sex, and age in regards to hypertension. Males are more likely to develop high blood pressure when compared to women. The top graphic illustrates how men and women from different races are prone to increased blood pressure. Hispanic and Black demographics are at a higher risk than their white counterparts. Cultures for each ethnicity also heavily influences hypertension risk due to the type of food they eat, how educated they are in regards to cardiovascular health, and access to healthcare. The bottom graph illustrates how age affects risk for hypertension. As a person ages, their body just becomes more inefficient when it comes to maintaining homeostasis. The heart having to compensate more, plus a typical geriatric sedentary lifestyle, increases the risk for hypertension the older a person gets. Acute symptoms for hypertension usually do not affect those in the prehypertensive stage or in the lower hypertensive stage. It may take years to develop a very high blood pressure. However, it's also dependent on the lifestyle. A person with an extremely poor lifestyle can easily reach prehypertension within a couple months and full-on hypertension within a year or more. Those with severely high hypertension, for example, 180 systolic over 100 diastolic, may experience chest pain, anxiety, nosebleeds, nausea, stomach pain, difficulty breathing, dizziness, blurred vision, headaches, buzzing in the ears, or confusion. Those who have been chronically living with hypertension over many years may face any of the acute symptoms more frequently, but they are also at a higher risk for more serious conditions. Coronary heart disease, also known as heart attacks, can develop due to an obstruction within the coronary artery. The obstruction may be caused by atherosclerosis or a blood clot lodged in the artery. Hypertension can also push blood clots into the brain and potentially cause a stroke, either hemorrhagic or ischemic. A hemorrhagic stroke is when the blood vessel wall ruptures and bleeds within the brain. An ischemic stroke is caused when a blockage within the blood vessel impedes blood flow in the brain. Hypertension can also negatively affect other organ systems, but I'll explain more in the presentation. While there is no magic cure for hypertension, there are a variety of treatment options that can help manage blood pressure. The hope is to overall improve blood pressure, but the main goal is to keep it from worsening. The best approach, but arguably the hardest, is to have sudden changes in lifestyle factors that affect blood pressure. It could be changes towards diet, exercise, stress, and or substance use. Many doctors prescribe medications to assist managing blood pressure for those who seek additional assistance. Lifestyle changes take quite a bit of time to revert blood pressure, so prescriptions such as ACE inhibitors, ARBs, calcium channel blockers, and diuretics quicken the process and allows it to be more manageable for patients that can't easily change their lifestyle. Hypertension can create a complication if a patient is trying to receive treatments for any other conditions. Many surgical screenings require the patient's blood pressure to be assessed due to possible bleeding issues. High blood pressure can prevent blood clots from forming effectively, which causes excessive bleeding. If a patient is taking a blood pressure medication, they must consult with their medical provider if they can safely take it with other medications. Adverse reactions may occur when mixing prescribed medications. For example, lisinopril, an ACE inhibitor, should not be paired with ibuprofen, a nonsteroidal anti-inflammatory drug, due to the ibuprofen reducing the effects of lisinopril to reduce blood pressure. Risk of a stroke or heart attack after a surgery can also be increased because a blood clot can be dislocated and head towards the brain or heart. Despite the heavy effects hypertension has on the cardiovascular system, it also negatively affects other organ systems. I already mentioned how high blood pressure affects the brain, but it can also affect other parts of the nervous system. The eyes, for example, can undergo a subconjunctival hemorrhage from blood vessels rupturing due to the excessive pressure. This can cause blurred vision for the duration of the bleed. The kidneys from the urinary system can also be affected by having damaged arteries surrounding them. This causes the kidneys to lose blood filtering function and are unable to properly regulate blood pressure even further. The portal vein in the digestive system can also develop portal hypertension. This condition may cause ruptures in the portal vein system, leading to internal bleeding from the stomach, intestines, pancreas, and spleen. The compressed portal vein can also cause the liver to lose blood filtering capability, which affects the amount of filtered blood going to the heart and brain. Even though hypertension can't outright be cured, it's still a preventable condition if caught early enough. Improving your diet alone can help eliminate several factors from increasing blood pressure. Avoiding food high in LDL cholesterol and sodium can reduce plaque buildup in the blood vessels. An active lifestyle also improves cardiovascular health and, in many cases, reduces blood pressure to a maintainable level. Moderation is key when consuming substances known for stimulating increased heart rate, such as nicotine, caffeine, and narcotics. However, avoiding them is still the best for prevention. Education on the topic is a major key to plan accordingly for prevention. If you know your family history contains hypertension, it's best you be evaluated by your healthcare provider and discuss possible treatments and plans. Even without a family history, one should regularly be seen by their provider for a routine checkup to make sure the body is healthy.
Hypertension is a difficult condition with many causes that may go unnoticed. Thankfully, there are many treatment options to help manage hypertension and possibly improve blood pressure. If you're diagnosed with hypertension, please do not ignore it as it could lead to further complications in the future. It's important to have a certain level of self awareness in order to avoid health issues. It's best to seek health care early and address the issue rather than waiting for a disaster to happen.